Hey guys, Eric Christensen from Chandler Physical Therapy here. One of the things that drives me nuts when people come into the clinic is they come in and they say, "Oh, I've been told I have a longer leg." And while in certain cases that can be true, usually that's a case of significant trauma, or if you had a serious joint replacement go wrong, or they couldn't find the right piece, or perhaps you had some sort of bony issue that they had to take some of the bone out. Rarely do people benignly have leg length discrepancy issues. One of the big things that I see is that people will often have a pelvic imbalance, whereas the muscles in the front of the pelvis are too tight and the backside of the pelvis isn't acting strong enough to balance that out. So what that does is create a relative anterior tilt. So I drew a sweet little original illustration here. And so if we look at this is a side view of the pelvis, the F being the front, the B being the back. If we look at this, what happens is that little hole with the dot in it is where the hip bone attaches to the pelvis. And as you can see, it's a little bit lower into the front. So if we have muscles in the front of the pelvis pulling on it more than the back, what happens is it gets pulled like this. And what that does is it pulls that hole where the leg attaches to it down a little bit. And as that pulls it down, it pushes the leg down, and that can give the illusion of a much longer leg. Really, the leg isn't longer, it's just the relative position of the pelvis. And when you get really, really tight on one side compared to the other, that can give you the feeling and the appearance of having a longer leg. But really, all we got to do is correct the tightness in the front of the pelvis by balancing out the backside.